First News with Keeler in the morning on WIBX and WIBX950.com.
This podcast is sponsored by Cloud Optimizer.
As a business owner or IT manager, are your cloud investment costs going up and you don't know why? It's time for Cloud Optimizer. As you migrate your business to the cloud, what you're spending and why you're spending it can get a little hazy. But Cloud Optimizer clears up the mystery and puts the cloud to work for you. Cloud Optimizer starts by analyzing usage patterns, right-sizing resources, leveraging discounts you may not be aware of, implementing automation, and much more. And by reducing unnecessary expenses and maximizing performance, Cloud Optimizer guarantees you a savings of 5 times what you spend for their service. As you utilize cloud-based services more and more, you don't have to lose sight or control of your spend. You can stay agile, streamline your costs, and optimize your performance, plus save significant money with Cloud Optimizer.
Make the cloud work for you with Cloud Optimizer. Get a free assessment and find out how much you can save by going to cloudoptimizer.com. Go to cloudoptimizer.com for your free assessment. That's cloudoptimizer.com.
Getting a bit of an English lesson here this morning. On the line to maybe even add more to it is County Executive Anthony Picente. Good morning, and welcome to the program.
Good morning. Thank you. Thank you for allowing me to join you in New York City, although I'm here.
Right. Yes. All right. So, for Andrew, are you noticing we're getting a low level there?
On Tony, yeah.
On Tony. Hold on, Anthony. Let me just. I guess talk as loudly as you can into that phone, and we'll do our best to get you in there. This should be better. How about now?
Is that better?
Is that better, Andrew? I think it sounds better here.
That sounds good.
Okay, County Executive Anthony Picente, good morning. I know speaking yesterday, talking about the virus and as it is expanding right now, and in the summertime, which we didn't get this last year.
No, we didn't. And, the numbers, I went through a lot of numbers yesterday, but, in particular, when I saw the 97-day number yesterday, which, is as good as 100 as you can get. I felt that it was important to do a briefing and really reiterate what we're dealing with. And I just heard Dr. Hall on your show, who obviously does a great job all the time, but also said, look, we're still in a pandemic, and that's we are, as much as we'd like to think we've moved into different territory, but we're still dealing with this, and the numbers don't lie, and they're alarming, and people need to know that. And in particular, I think, the number that it didn't get lost, but I gave a lot of numbers yesterday in terms of where we were, especially as you said, we're at the last week of August, heading to school, and it shocked me because we see these every day. I go through the data, but from August 1st to the 23rd, 165 cases from the ages of 0 to 17.
We were not seeing that before.
And that's the number that I think is they're all important. Don't get me wrong, but the relevancy of what, of school opening in just days ahead, and the furor over masks and everything else. And we've had 165 cases in those age groups without school open, without, with people, without, for the most part, probably without masks in a lot of those situations, and not in a controlled classroom. So, that's why I felt it's important to stop this nonsense about what we need to do to get our kids back in school, and why masks are important and necessary. And, for all intents, I believe the governor has mandated that. And, we're looking for more clarity, but I don't see that there needs to be much more.
And there are many arguments out there that I may not agree with, but I think are probably valid arguments. At some point, I have a feeling, like what has happened with colleges, when the vaccine is available for 12 and under, I think at some point there's going to be a state mandate for children to be vaccinated. And I know people are going to go crazy over that. And at least that's an argument. I believe I would have our kids get vaccinated. My kids are vaccinated. But at least that is an argument that has some validity to it. this mask thing is like saying, it's not fair. My kid should be able to smoke at the age of 16. I mean, what are we doing here?
Well, yeah. Look, the fact that we've gone so long and has not had the approval of under 12 vaccine just says a lot right now too. And
sure.
And to the point that, you just made. So, that'll be the next round. And I can understand that more than putting a mask on my child. And I've had many parents, and some of the kids don't think twice of it now. They're better than, they're more disciplined than the parents in wearing a mask in that regard.
I agree with that. I see that all the time. The kids wearing a mask and the parents not.
Yeah. To argue though that, I contrasted this yesterday, with going, and look, you've been through this. We've talked for, 18 months, steady, the fact that, these are parents, we got to get our kids back in school. We got to get our kids back in school. The remote learning's not working, blah, 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 all that, and it's not right. And now we're into, okay, they're going back to school and when they need to, but they need to wear a mask at least, for the time being. Yeah. And that's becoming, and look, the other point here is, and you made it as well, and I made that yesterday. It's like, why does this have to be a hostile, nasty, and really, vile argument with school board members who are trying their best to get kids back in school.
Yeah.
And
I feel bad.
What message are we sending there too?
Yeah. Again, another argument that I can see the validity of is parents were rabid over the fact that their kids weren't in school. And it was a bit of a catch-22 for schools last year because of the state's mandate on social distancing. But again, I understand that argument. I understand wanting your kids in school. That is a valid argument.
But the other thing last year was, because of, some of the things had changed. Remember, the quarantine was 14 days, not 10.
Right. Yep.
The issue of those schools that did attempt in person or even staggered days or learning or optional, when there was an outbreak, and the same goes this year. That doesn't change. If your child is not wearing a mask, and, for whatever reason, and, others in that classroom, will be quarantined for 10 days.
Yeah.
Under the circumstances, because they're not vaccinated. So, which, again, and that goes for anybody between 12 and 17, obviously, that are eligible, but they're not vaccinated. So, we have all of those factors playing in here, and that's why it really is. Let's keep our eye on the ball. What do we want first? We want them safe. That's number one. That keeps them safe. The masks keep them safe. Stop telling me that science says otherwise. It doesn't.
Okay. I want to switch. Anything else you want to add on the pandemic?
No, I just look. I think we just have to be aware of these numbers have been going up. Hopefully they'll level off. Hopefully. We really need to, adhere to masks. I suggested wearing them when you're going out in certain indoors and places. It's not a mandate. It's a suggestion. Given where we are, we can bring this down. And we need more of the adults, I will say that, to get the vaccine. Let's go back to that. There's still a great percentage that need it. And a lot of them are the parents of these children. So
I want to switch to the hospital.
Sure.
And this week the story came out that Oneida County's IDA is looking at eminent domain on a property which is in the footprint of the hospital, on a property that the hospital, I think the part of this that I didn't understand is that this location was the original location that the hospital was looking for as part of their medical office building. But instead, a deal that I believe seems to be being put together with Mayor Palmieri in the city of Utica for a competitor of MVHS to come in and do a medical facility in that same building, so basically taking the building away from MVHS. Is that the case? Are these two buildings the same building that the city and county are fighting over?
Well, it's one building. We're not fighting over it, in that regard. It's one building. It's the 411 Columbia, which is the only building I would mention or add that is in the hospital campus footprint remaining that's still standing. Everything else has been removed. And it was standing there because the owner had refused to sell to the hospital system at, their appointed price. And so it was going to be eminent domain by the city. It was part of that plan. And then the city withdrew their plans to do such and got involved with a developer and other physicians, as I understand it, to do that. And now, but that building, that site, that area, or that exact footprint of that building always was, from the very beginning, a part of the plan that was approved, through seeker for the medical office building that would include the ambulatory surgical center, which is essential in building the hospital and a part of the overall CON that was granted in that. The Department of Health likes to have, as you're well aware in dealing with this yourself and family and everybody else, and this, ambulatory surgical centers are important on hospital campuses for the very nature of getting people in and out in those cases and alleviating what's on the side of the hospital. So that was always in the plans. It's always been there from the very beginning. That was always a part of the design, that medical office building on that site. So there was a curveball or whatever you want to call it thrown, and so the IDA has been a partner in this as well, issuing bonds, with helping the hospital move forward, but also a mechanism to provide condemnation if necessary, and so that's what they're looking at.
So instead of fighting, I should have said basically the city is competing. The city of Utica is competing with MVHS.
Well, I think, it's a matter of, I don't know if they're competing, the developer's competing. There's really a lot of questions that need to be answered. But the bottom line is, why are they doing that when this was always a plan? As I said, it was always, from the very beginning for the last 4 years, a part of the overall hospital landscape. It was clearly identified as such. As a building also, I would add, that would, be on the tax rolls. This is not a part of the hospital, itself. This is an independent that would also be housing, the cardiology, group and the surgical center, in tandem there, and possibly others. But it's always been a part of the plan. So it's very confusing as to why this got played as a little bit of a chess game.
What is the difference in numbers? So you said that the property owner rejected the MVHS deal. How far apart are they from the deal that Mayor Palmieri and this developer is putting together here?
I really don't know what and it's not, I don't know and cannot disclose what the hospital offered the property owner. I understand, though, that the potential buyer, because it hasn't switched hands, it's still owned by the current owner of the building, the O'Brien building, is over $1 million, which it hasn't been confirmed. So I really don't know what the exact figures are.
All right. So the county is moving forward, or is contemplating a move forward with eminent domain?
The IDA is.
The IDA, right?
The IDA is.
Okay,
correct.
So they are moving forward on that.
They are.
Okay. Anything else you want to add before we head to the weekend?
No, this is the time. Again, just go back to the virus. Keep an eye on the numbers. Keep an eye on what's happening, and let's try and improve. We are going to be starting to do boosters as well, and we talked about that yesterday. We're starting to plan pods for that in the next month, and see what where that goes.
Yeah.
And we anticipate that we're going to have long lines there again. So we're ramping up for that.
All right, County Executive Anthony Picente,
All
thanks
right.
so much. Enjoy the
Thank
weekend
you.
and go Mets.
Oh yeah, there you go. Yeah.
All right, thank you.
Have a go and stay
You
safe,
too.
guys.
Thanks so much.
Bye-bye.
What's the easiest choice you can make? Window instead of middle seat? Picking a vendor who sends a great gift basket? Outsourcing business tasks you hate? What about selling with Shopify? Whether you're selling a little or a lot, Shopify helps you do your thing, however you cha-ching. Shopify is the global commerce platform that helps you sell at every stage of your business. From the launch your online shop stage to the first real-life store stage, all the way to the did we just hit 1 million orders stage. Shopify's there to help you grow. Whether you're selling scented soap or offering outdoor outfits, Shopify helps you sell. Wherever and whatever you're selling, Shopify's got you covered. Sign up for a $1 per month trial period at shopify.com/try. Go to shopify.com/try now to grow your business, no matter what stage you're in. Shopify.com/try.